Hey guys, my name is Milan. I'm a physiotherapist with Pain Free Health Clinics. Today I'm going to discuss neuropathic dysfunction. This is a very exciting topic for me because the majority of the patients that do come into the clinic exhibit some sort of a neuropathic dysfunction. Neuropathic dysfunction is something that potentially could have started with an injury in your 20s. Pain that has been occurring for a while, progressively into your 30s, the pain gets worse. The pain occurs over time and it persists. Patient's been trying to work through it, compensating, and it gets worse, does not get better. Before we get into details of neuropathic dysfunction, I wanted to highlight three phases of pain. There's immediate pain, for example, after you strain your ankle. There's acute pain, where you get the inflammation and the swelling after. And then there's chronic pain, where the pain persists even without injury to the tissue. So neuropathic dysfunction is a part of chronic pain. The constant ongoing pain in the case of neuropathic dysfunction and chronic pain can be explained by Cannon's law, which states that the nerve, when it's stretched, either suddenly or over time compressed or angulated, can lead to supersensitivity, meaning tenderness of the tissues that the nerve is innervating. Initially, what we see in neuropathic dysfunction, the patient may not feel any pain, but rather you might get some skin changes, you might get some muscle banding, which are also called muscle knots. You might also start getting some muscle weakness, some muscle cramping, and then that also persists to dull, achy pain that does not seem to go away and stays consistent. It's a continuum that occurs over time and doesn't usually just happen in 1 or 2 days, which is also why it can be difficult to treat and it takes time to treat such a condition. In neuropathic muscle, there's the muscle banding or the muscle knotting, where the muscle is not able to relax. And as a result of that, at the beginning when the patient does come in, we do not necessarily recommend doing exercises right away because those muscle knots may not react favorably to exercises because they're already hypersensitive, especially during a flare-up. And in addition to that, when the muscle knots do occur, there's a lot of contraction and oxygen's not able to go in, toxins are not able to go out and be recycled. And that is why what we do first at Pain Free Health is we do a biomechanical assessment, see what the problem is. We do hands-on therapy, whether it's chiropractic, physiotherapy, massage therapy, dry needling, all kinds of different modalities, acupuncture. Once the patient is out of pain and the flare-up is gone, then what we start to do is we progress with active rehabilitation and exercises, because we know in the long term, exercises and loading the muscles properly will give you the best benefit, and it will keep the flare-ups away because you're loading that muscle properly and strengthening it for future use.